We're talking to Dr. MFaulkner, the professor of internal medicine at Meharry Medical College. And Dr. Faulkner, before we had our first commercial break, we promised that we'd give you an opportunity during this second segment to sort of enlighten our audience about kidney disease and hypertension, which is to say that you've got all kinds of experience dealing with this disease. And over the next 8 minutes, let's see if we can sort of give that kind of information, and so that they can understand really how very, very important it is that we pay more attention to this and the impact that this disease is having upon African Americans, especially upon everybody, right, but especially upon African Americans.
Well, when I was here before with you, several years back, the #1 cause for African Americans being on dialysis was hypertension. It has since been deemed the second most common cause, with diabetes being first. But the interesting thing is that study that I talked about at that time, African American study of kidney disease and hypertension, we discovered that treating patients with an ACE inhibitor like ramipril, captopril, lisinopril, as you do in diabetics with proteinuria or protein in their urine, seems to have the same effect on patients with kidney disease secondary to hypertension with protein in their urine. So now we've advocated that you treat patients with protein in their urine who have high blood pressure, that have lots of protein greater than 2 grams with an ACE inhibitor. So from that time to now, we've gotten significant information on trying to decrease the progression of kidney disease and hypertension, which has made a very successful study. But we also found out that there's another problem that we have. Even though we can treat the kidney problem now, or we can slow the progression, a lot of patients seem to have heart problems, and a lot of patients are dying from heart problems who have kidney disease. So now we're involved in a new study that's looking at hypertension and kidney disease, as well as lipids or cholesterol and fats in the blood.
So all of these will have an impact upon the kidney, that is the heart, and so it's not, the body is one, it's not isolated, that you can have kidney disease and it won't impact your heart and etc. Talk about this disease. I mean, I think that earlier you mentioned the fact that it's a disease of progression. Let's talk about how a person might, and I also understand that it's a silent disease. How can an individual determine whether he or she might have kidney disease?
Well, you're exactly right. It's a silent disease. You can't feel it. It doesn't hurt. You know, patients still go to the bathroom. And when you see them, you say, well, listen, you have significant kidney disease. You may be on dialysis in the next year or 2. They say, well, that can't be, because I'm still going to the bathroom. I don't hurt. Nothing's wrong with me. But you can have kidney failure without knowing it. The best way to find out is have your doctor check your blood for what we call a creatinine. They check your blood for your creatinine. If it's in normal range, you're pretty much okay. If it's out of range, then you must definitely have it investigated.
And so there is at least a test that can, now who are some of the persons that might be susceptible to kidney disease? Is there any kind of lifestyle or any other thing that you might become involved in that could decrease an individual's possibilities of contracting this disease?
Well, some of the things that you might have a higher risk for, if you're hypertensive, we already discussed that. If you have diabetes, definitely you are maybe at risk, because between a 10th to 26% of the patients who have diabetes, even at adult age, can have kidney failure. Patients who have diabetes type 1, who've had very early in life diabetes, they have a 40% chance of having kidney failure. So it's very, very, very prevalent for hypertension and diabetes to be at risk for kidney disease. If you have chronic glomerulonephritis from hepatitis, if you have had hepatitis C before, hepatitis B, you may be at risk for having problems with kidney disease. If you have HIV infection, there's a high risk of having kidney problems, especially if you're African American. If you have lupus or SLE, you have a high risk, if you're African American, for possibly having kidney damage.
You know, you mentioned diabetes. One of the national problems that we're having now has to do with childhood diabetes. Say something in reference to that. Would a child also be susceptible to this disease if he or she had diabetes?
Usually, yes, you can have it, but it takes about 10 years for you to develop kidney failure from diabetes. So if a child develops diabetes at age 6, yes, by the time they're age 16, yes, they could have a kidney failure. 10 years for both type 1 and type 2 diabetes.
And so all of these are very, very serious problems, and they cost the nation, in a real sense. Individuals who have these diseases, they can't work, they can't become involved in any kind of productive thing in society, and yet there's a cost that's associated with it. What about dialysis? What are some of the costs that are associated with this?
Well, it costs about $35,000 per year per patient to dialyze. It costs about $35,000 to $50,000 to receive a kidney transplant. That's why Medicare will pay for a kidney transplant in patients who are on dialysis, because the cost, the savings is so significant. The average lifespan on dialysis can be from a few months to 20 years. So you can average maybe 10 years. Even though textbooks say average lifespan is about 2.5 years, you find people living much longer than that. But people who have significant heart disease and other problems may die earlier on dialysis.
These problems are generally associated with the kidney, but they are not necessarily a part of why they die, in the real sense.
Exactly.
It's something that's sort of added on.
Exactly.
And of course, if you go into dialysis with a strong heart, well, the possibilities of you being able to survive longer perhaps is much greater. Is that what we're saying?
Yes, that's what we're saying. And if you the longer you survive, the more likely that you will get a transplant. But some people stay on transplant lists a long time, especially African Americans, because they do gene testing for determining who gets a kidney. And of course, if the race donates, then the genes in that population will come up a lot faster than genes in other populations.
And so that's why you at one time, as we make preparations for this second commercial break, Dr. Faulkner, that's why you at one time was involved in trying to encourage people to donate kidneys and other organs. Was that the thrust of the program that you were involved in, that you explained to? Very good. And of course, Dr. Faulkner, this is exactly the information that we wanted you to give our audience today. And when we come back, we want you to think in terms of hypertension and some of the other things that can sort of alert our population, our audience, in a real sense, to some of the things that they can do in order to prevent this disease. And of course, we'll be back with our audience following this very, very short commercial break. The topic is